Okay, this is a very quick video to run you through the causes of hypertension. This diagram serves to help you recall these causes in a visual format. So from the top down, we have diabetes, acromegaly with this sort of large jaw, as it were, to remind you of that, polycythemia rubra vera, elevated red blood cells is what we see in that condition. Problems with the thyroid gland, either blue, as it is illustrated here, underactive, hypothyroidism, or red, overactive thyroid, hyperthyroidism. Overactivity of the parathyroid glands, hyperparathyroidism. These glands sit in the sort of tips of the thyroid gland, as illustrated here. Coarctation of the aorta, a narrowing of the aorta, a congenital condition. Problems with the adrenal gland, so Cushing syndrome, which is associated with elevated cortisol produced by the cortex of the adrenal gland. A pheochromocytoma, which is associated with elevated adrenaline, a tumor of the medulla of the adrenal gland, or a Cons tumor or Cons syndrome, where there's a tumor of the cortex of the adrenal gland there. Other problems associated with the kidneys, so glomerulonephritis, inflammation of the kidneys, Wilms tumor here, a tumor of the kidneys, pyelonephritis, infection of the kidney, stenosis or embolism of the renal artery, or an obstructive uropathy. So lots of causes in the kidney, as well as here illustrated polycystic kidney disease. In pregnant ladies, preeclampsia can present with high blood pressure, and excessive or chronic alcohol excess can lead to high blood pressure too. And don't forget white coat hypertension, just the anxiety that some patients experience when they visit the doctor. Of course, you can remove the labels from these diagrams, and I'd encourage you to do so you can sort of test yourself and hopefully take away this sort of rather peculiar image in your mind's eye, so that you always know very easily the causes of hypertension. This diagram and many more are available in the app Picturing MD. Lots of differentials, other signs and symptoms. In actual fact, as it happens, we've got acromegaly in there. So that's a way to remember the features of acromegaly. For example, trauma topics are covered, including management of the airway, in terms of assessing the airway, what do you look for, what should you be thinking about, and lots of other tips and tricks there. Some anatomical sections too, covering things like the cross-section of the leg, or features such as anatomy of the eye, and so on.